He is a dental surgeon who is well aware of what he's talking about. In fact, he discovered things that other dentists do not even dare to think about. Sometimes you have a simple headache and you think the main issue is the headache, where in fact is related to a toothache or even something more serious. And today, Dr. Rogerio Pavon is going to talk about a topic that myself had never heard of before, but I will clarify it all with you today, which is the bowling ball syndrome. Have you ever heard of it? No? Yes? So pay attention as Dr. Rogerio Pavon will explain it all. Welcome, Dr. Rogerio.
Thank you very much, Isa. It's always a pleasure to be here with you.
Now, what is this whole bowling ball syndrome?
Weird name,
Never
right?
heard of it.
That's right. The name is in fact quite weird. But the author that discovered it says that our head has about the same weight as a bowling ball. The syndrome are twists that we have in our cranium. What happened was, during all my career, we...
It's a very long one.
Yes, a little bit, right?
It is a very consecrated history.
During the diagnosis process, we used pictures and noticed that with a high frequency in our clients, one had an eye higher than the other, the ears has one side higher than the other, and also the arch was unbalanced. So when the arch leaves it plumb, well, I thought that the arch was the reason of it. And so we started using devices to compensate and supplement or correct arches detour. I was never able to correct the ears, the eyes detour. Sometimes an eye was to the front and the other to the back, and we were unable to fix it, but we were able to create harmony with the body. A lot of clients, for example, had knee pains, and it was related with this arch detour. Consequently,
And so the pain in the knee is actually related to your dental arch?
exactly.
Wow, so the person will go to the orthopedist where in fact they had to go with Dr. Rogerio Pavon.
Never eliminate the orthopedist. Sometimes you go to the orthopedist and he only looks at the knee. If he only look at the knee, he will not see the whole picture. Have to see it all. If the arch is out of balance, the weight goes more to one side, creating an imbalance. Braces that we use as Polis and Dara, special braces that equilibrate the body and treat the pain, solving the patient's problem. Whenever it's possible, we would correct and harmonize the arch. However, as I was telling you, the part in relation to the eyes and the ears, we were unable to fix. And so we discovered an individual in the United States that was dying for a viral encephalitis. Found in this device the solution
To the problem.
to his problem.
What does this device do?
It's a biomodulator, but I will tell you about this soon. And so what
He's
happened
doing
was,
suspense.
yeah, it's to hold the audience. I'm just playing. You are all a wonderful people. But it's so we have a storyline, right? Is
So we can have a beginning, middle, and ending.
exactly. And so this person, when treating himself, he found the solution to his deadly viral encephalitis. His name is Dr. Jerry Tennant, and he recovered with this device. The second step to his recovery was to treat the mouth. And since then, he started to value dentistry immensely. So I went to meet him in person and trained with him to learn how to use the biomodulator. And what caught my attention was that in his demonstrations, that we show you the image here to your audience, corrections were immediately. Imbalances and
So in the first
differences
session there were already results?
in a lot of them. And in my experience with the cases we have been treating, 70 to 80%, you can already see the body balancing in one session. When I saw the first video demonstration, I said, I need that.
Take it to Brazil.
Whoa, I need it fast. So I called them and asked, when is the next seminar? I want to participate. And they said, next week. And I was like, wait, let me explain the contest better. I'm in Brazil, need to see flights. When is the next one? And a month later, I went there and I brought the device to help people. And because, our desire to help others and see them happier is very big.
I think what bothers the most, and I'm speaking for myself on this, right, doctor? And I believe that that's what happened to you as well. Sometimes we feel a pain or a symptom and we go to the doctors and they don't know how to decipher what the problem is. no matter how good he is. And sometimes you're in the wrong doctor, and by the wrong doctor, I mean in the wrong segment.
It's not the professional's
No,
fault.
anyway,
For example,
the wrong specialty.
if the problem is caused by disaligned dental arch, the other doctor will not be able to correct it. He can medicate you, treat you, do physiotherapy if the orange is in the mouth. Only through that you'll be able to reverse it.
Do we have any photos to show this?
Sure.
Let's roll them so then we can understand better how the bowling ball syndrome works. That is your case. Pay attention because there is a solution with Dr. Rogério Pavon.
Take a look at this individual. In the photo above shows the before treatment. I would like you to notice that his right eye is higher than the left, and it's more to the front as well.
That's right.
His left finger is higher than the right. What happened is we have a little bone right here in the head called sphenoid, and it dislocates, and the doctor pulls you at birth. When you hit your head or similar, it dislocates and interferes in the arch, which is why a dentist is talking about this. It changes the arches and imbalances the client. So after the therapy, you can verify in the image that his eyes are in the right level and his fingers are also aligned. If you draw an axis, you can see, and the eyes are leveled and more open. It's a huge difference. He was very happy, so was I. Love to see this kind of results.
And that after how many sessions he obtained these results?
3 sessions of 5 minutes.
And it's 5 minutes a session? And these sessions, what is the frequency of them?
It all depends. If the case is not so complicated, we schedule them every 15 to 20 days. If you have a more complicated case and need fast results, you can schedule weekly.
Meaning in 3 weeks you're able to solve the client's issue.
Exactly.
Amazing. Now, I'm curious to know what it looks like, that thing besides you. This device there, can we show it now?
Yes, of course.
So let me see.
First of all, I want to show this. This is from the folks from USA. I want to thank Professor Jerry Tennant for doing an amazing research, utterly brilliant, from Synergy Medical Group. We are proud to be part of the team, and the device can be used in this way. For example, the therapy works like this. Place this on the neck, 2 minutes and a half one side. It does a tingle. It's an electrical magnetic pulse. 2 minutes and a half in the other side. As we want to work in these muscles, so we're going to use this device because it adapts better to the neck muscles. 2 minutes and a half in one side, 2 minutes and a half in the other. Some movements are made so the body can reprogram. In fact, this is it. I love it. You know it. Bioreprogramming is what I do.
In fact, he's excellent at it.
And this is a bioreprogramming in my opinion. But he gave it another name. He named it a biomodulator.
But it doesn't change much, right?
No.
It doesn't change the result, right?
That's right. So this is a device that works in EMP. It's a result for more than 30 years of studies. It's a revolution. It saved his life. And it can save many others. Of course, as a dentist, I will stay in my own area. It is the mouth.
But parallel to that, if you notice any symptoms or if you have a dislevel on one side or the other, they say we're never the same on both sides, right?
Before I knew this,
What I mean to say is that neither side is the same.
so before I knew this, I thought the same way, but I felt something was wrong, because when the arch was imbalanced, there is symptoms on the body. There is scoliosis, on level on the shoulders. We would correct and compensate as possible. With this, the corrections get better, because the asymmetry, as we see... Oh, there is another picture. Can we show it?
Of course, let's show it.
It's amazing change on patient's hips. It was good that she was wearing a strapped blouse, where you can see a very visible
Wow, look
difference.
at the difference.
Isn't it amazing? And you ask me, how many sessions?
How many sessions?
1. She's exactly...
So only a 5-minute session and you solve the problem.
It's only 10 minutes after.
Wow, this is amazing.
This possibility left me, wow, as you said. This is the right expression.
And sometimes a person takes so many medications to fix the pain. Because a woman that is imbalanced in this way, imagine the pain that she feels on her back or in her cocks, or even in another specific area of the body.
No doubt.
And sometimes with a treatment like this, not only can she fix being aligned, even more prettier, and with no pain, which is wonderful.
Symmetrical.
You know that one of these days I had a tooth pain, and
Should have called me.
you were traveling in the United States. And so I had a toothache, and I was like, "Oh my God, what a pain!" And I swear to you, I looked at myself and I thought, "Wow, I'm balanced." And it's just like Dr. Rogério was saying, you move your body towards the pain. It feels like the weight is heavier there, right?
It's a mechanism of compensation that
That's
the body
true.
creates. It does its best.
That's true. Now, if you want to do a complete anamnesis, not only of your mouth, but also of this word that Dr. Rogério Pavão, that is the
Oral reprogramming.
bioreprogrammation. Let's take advantage that he is here and ask him to explain it. Now that you understand what is the bowling ball syndrome, where you already saw that you can get amazing results in some cases in only one section. But I want you to also understand this, that is sensational that he does, which is called
Oral reprogramming.
Very good.
As the name explains, it's about reprogramming the body balance through the mouth. So that way we can work with the digestive system, respiratory systems, in fact, coronavirus. If you want to prevent it, the best thing you can do is to improve the immunological system. The best solution to breathe better. Breathing better?
Without a price, right?
Yeah.
To breathe better, you learn how to do it.
We also created devices to improve the client's breathing. Using it, we can measure an increase of 20 to 40% respiratory flow.
Oh, you mean the braces?
Yes, the braces.
Oh, I understand, because there are those braces which in fact they're invisible.
Exactly.
The braces are invisible and you put them and then you can align your body as a whole.
That's right. This is bioreprogramming, to care to the body's health through the mouth.
Love it. Did you enjoy it as well? I'm sure you did. If you want to know more details, get in touch with Dr. Rogério Peixe on Instagram, Facebook, YouTube. In fact, do you still have your radio show?
No.
No, but it was a success.
We are on Spotify now. It was 25 years of radio show. Now on Spotify and soon on iTunes.
And what is the contact? Let's share it.
Rogério Pavão, you will find in social medias. Just type it there. Instagram is Rogério Pavão Official. YouTube is Dr. Rogério Pavão. We have a channel there, and the telephone number is, as most preferred, it's plus 5511 3287 0433
3287
0433 or plus 5511 3287 7010.
Show the WhatsApp there as well, because I know that there's a lot of people that prefer WhatsApp so they can send already pictures with their problems. To illustrate what's troubling you, take a look at the WhatsApp over here.